In this class, we are going to discuss about management of cancer. There are many options available to treat cancer. Depend upon the clinical condition of the patient, the treatment of choice or cost of the therapy. Based upon these two things, physician can choose the surgery, chemotherapy, radiation therapy, and palliative care. Palliative care is a treatment which attempts to make the patient feel better and may or may not be combined with attempt to attack cancer. Palliative care is a assurance given to the patients like physical assurance, emotional, spiritual, and socio-psychical distress experienced by the patient because of the cancer. Unlike treatment that aim to not directly kill the cancer, that give the primary goal to improve the quality of life of the patient. Surgery is the primary method of the cancer when the physician finally diagnosed as the cancer or benign or preliminary condition of any solid substance present on the organ. They will remove by using surgical method. This is the very primary method. With this help of the method, the patient can survive for sometimes, and the growth of cells also stopped when the cancer was found in the early stage of stage 1. In localized cancer, surgery typically attempts to remove the entire mass along with certain cases lymph node in the area. For some type of cancer, that is include needed to eliminate the cancer. Chemotherapy, in addition to the surgery, has proven useful in number of different cancer types like breast cancer, colorectal cancer, pancreatic cancer, osteogenic sarcoma, testicular cancer, ovarian cancer, certain lung cancer. The effectiveness of chemotherapy is often its toxicity to other tissues in the body. Radiation therapy involves using of ionizing radiation in an attempt to either cure or improve the symptoms of the cancer. It is used in about half of all cases in the form of internal sources or external sources. Radiation is typically used in addition to the surgery, chemotherapy, but for certain types of cancer, early head and neck cancer may be used alone for painful bone metastasis. It has bound to be 70% of people very effective in the bone cancer. Some of the alternative methods of treatments also available for the cancer, but that it is very not having much effective, but still in the practice that is what not proved, that is different from conventional therapy, not proved to the patient clinically. Immunotherapy or gene therapy or immunosuppressant therapy is the most advanced treatment nowadays in the developing form. Immunosuppressant drugs, what it will do means suppress our immune system, thereby the abnormal proliferation of cancer may be stopped. The new types of cancer treatments are there. Hormone treatments. These drugs are designed to prevent cell growth by preventing the cells from receiving signals necessary for continued growth and division. Breast cancer like tamoxifen, specific inhibitor target specific proteins process that are limited primarily to cancer cells that are much more preventable in cancer cells. Antibodies used in the treatment of cancer have been manufactured for use of drugs like Herceptin, Avastin. The use of normal occurring normal proteins to body own defense mechanism, abiraximab, rituximab, vaccines, these and all protein found, these and all prevent the growth of cancer. Treatment of cancer may aim to palliative, for example, prompt relief of unpleasant symptoms such as superior vena cava obstruction from the mediastinal tumor, macroscopic and microscopic feature of the cancer disappear. These and all because of the palliative care management. Surgery is to remove solid tumors, radiation to kill cancer cells to adjacent local or regional tissue, chemotherapy to kill cancer cells located throughout the body, anti-neoplastic drugs are to manage the cancer at the stage 3. Most of the recent anti-neoplastic therapy is based on develop of new combination therapy using existing drug. better understanding of mechanism of anti-tumor activity, development of chemotherapeutic approaches to destroy micrometastasis, understanding the molecular mechanism concerning the initiation of tumor growth and the recognition of heterogeneity of tumors, and single chronological cells can produce enough potent to kill the host. Unless few malignant cancer cells are present, host immune mechanism do not play a significant role in therapy of neoplastic disease. A given therapy result in destruction of constant percentage as opposed to constant number of cells, therefore cell kills following first order kinetics. Few examples of few most prescribed chemotherapeutic agents are classical alkylating agent, cytotoxic antibiotic, cisplatin, carboplatin, mitomycin, dexamethasone, vincristine, vinblastine, bleomycin, pilotoxins. These and all act at the various stages of the cancer. For example, in uh, carmustine, lomustine, that is act in the G1 phase. G1 is the preliminary arrangement of organelles, and G2 phase interferons. These are all the drug. It will stop the cell growth. It will stop the cell growth regulator, and it will destroy the G2 phase where the double-strand DNA was properly formed. Even in the cancer patient, that was improperly formed. These are all the drugs, that is the chemotherapy agents, that is the purest form of chemical substance, but this can be diluted with the proper dilution method, and it was given to the patient. Thank you.